Rahim. The quote for today is a healthy outside starts from the inside first. Today, the topic of my presentation is dietary antioxidants under the kind supervision of my professor, Dr. Saira Afzal. Learning outlines. Introduction of antioxidants, types of antioxidants, health benefits, food sources for antioxidants. Learning outcomes. At the end of this presentation, participants will be able to describe about antioxidants, oxidative stress, types of antioxidants, and their benefits on health. Introduction. Antioxidants are substances that can prevent or slow damage to cells caused by free radicals, unstable molecules that the body produces as a reaction to environmental and other pressures. They are sometimes called as free radical scavengers. The body also produces some antioxidants known as endogenous antioxidants. Antioxidants that come from outside the body are called exogenous. Mechanism of action of antioxidants. When a chemical reaction breaks the bonds that holds paired electrons together, free radicals are produced. Therefore, in a free radical compound, there is a single unpaired electron in the outer orbit. A single excited electron is searching to become part of a paired set and will steal an electron from another, thereby attempt to accomplish its pairing. During this step, the original free radical becomes stable, while the neighboring atom, by losing an electron, becomes a free radical itself. This now free radical will then seek out another atom to steal from, creating a chain reaction. The extreme reactivity of free radicals driven by the need to acquire another electron underlies their ability to interact with and ultimately damage tissues. Molecules such as DNA, proteins, lipids, carbohydrates are damaged. Free radical collective terms are reactive oxygen species, reactive nitrogen species, and include not only the oxygen or nitrogen radicals, but some non-radical reactive derivatives of oxygen and nitrogen. The superoxide radical is the main free radical produced in the living cells. It is produced by the electron transport chain in the mitochondria. Free radicals generated naturally during oxidative metabolisms. The activation of macrophages in stress condition is another important source of free radical generation. Because free radicals are toxic to cells, the body has developed a sophisticated antioxidant system that depends on antioxidant nutrients like vitamin C, E, beta carotenes, and other carotenoids as the major vitamin antioxidant source. In addition, several metalloenzymes, which include glutathione peroxidase selenium, catalase iron, and superoxide dismutase copper, zinc, and manganese, are also critical in protecting the internal cellular constituents from oxidative damage. Oxidative stress has been linked to heart disease, cancer, arthritis, stroke, respiratory diseases, immune deficiency, emphysema, Parkinson's disease, and other inflammatory or ischemic conditions. Antioxidants are said to help neutralize free radicals in our bodies, and this is thought to boost overall health. The source of antioxidants can be natural or artificial. Certain plant-based foods are thought to be rich in oxidants. Plant-based oxidants are kind of phytonutrients or plant-based nutrients. Free radicals are waste substances that are produced by the cells. Trusted sources as the body processes food and reacts to the environment. If the body cannot process and remove free radicals efficiently, oxidative stress can result. This can harm cells and body functions. Free radicals are also known as reactive oxygen species. Factors that increase the production of free radicals in the body can be internal, such as inflammation, or external, for example, pollution, UV exposure, and cigarette smokers. These are the factors that lead to the formation of free radicals. Inflammation, metabolism, smoking, ionizing radiations, air pollution, UV light all lead to damage of DNA. And thus free radicals are released. Types of antioxidants. Based on their activity, they can be classified as enzymatic and non-enzymatic oxidants. Based on solubility, antioxidants can be classified as water-soluble or lipid-soluble. According to size, they can be categorized as small or large molecules. On activity basis, enzymatic oxidants. Dangerous oxidative products can be converted into hydrogen peroxide and then to water by enzymatic antioxidants that are able to break down and get rid of free radicals in a multi-step process in the presence of cofactors such as copper, zinc, manganese, selenium, and iron. Non-enzymatic oxidants. Vitamin C, vitamin E, plant polyphenol, carotenoids, glutathione are non-enzymatic antioxidants which act by interrupting free radical chain reactions. Based on solubility, antioxidants can be classified as water soluble or lipid soluble. Vitamin C is a type of water soluble vitamin that is found in cellular fluids such as cytosol or cytoplasmic matrix. While for lipid soluble antioxidant, vitamin E is a very important example. Based on size. According to size, antioxidants can be classified as small or large molecule antioxidants, small size antioxidants. These small molecule antioxidants neutralize the reactive oxygen species in a process named radical scavenging and carry them away. Vitamin C, E, carotenoids, glutathione are the main antioxidants in this category. Large size antioxidants. Large molecules antioxidants include enzymes and sacrificial proteins like albumin that absorb reactive oxygen species and prevent them from attacking other essential proteins. Based on their occurrence, antioxidants can be categorized as natural or synthetic. Natural antioxidants, antioxidant minerals. These are the antioxidant enzymes cofactors like selenium, copper, iron, zinc, manganese. Antioxidant vitamins, these are important and required for most body metabolism, like vitamin C, E, and B. Phytochemicals are neither vitamins nor minerals. Examples include flavonoids, carotenoids, carotene, lycopenes, and herbs and spices such as thyme, nutmeg, clove, black pepper, ginger, garlic, and derivatives. Synthetic oxidants are these compounds include butylated hydroxyl anisole, butylated hydroxyl toluene, and metal chelating agents, EDTA, etc. Antioxidants can protect against the cell damage. These are the health benefits of antioxidants that free radicals cause. That is known as oxidative stress. Activities and processes that can lead to oxidative stress may be mitochondrial activity, excessive exercise, tissue trauma due to inflammation and injury, ischemia and reperfusion damage, consumption of certain foods, especially refined and processed foods, trans fats, artificial sweeteners, certain dyes, and additives. Smoking, environmental pollution, radiation, exposure to chemicals such as pesticides and drugs, including chemotherapy, industrial solvents, ozone, and such activities and exposure can result in cell damage. The damage that is caused by oxidative stress has been linked to cancer, atherosclerosis, and vision loss. An intake of antioxidants is believed to reduce these risks. According to a study, antioxidants act as radical scavengers, hydrogen donor, oxygen electron donor, peroxide decomposer, single oxygen quencher, enzyme inhibitors, synergists, and metal chelating agents. Antioxidant supplements may help reduce vision loss due to age-related macular degeneration in older people. Inflammation impedes skin renewal process. By reducing inflammation, antioxidants allows skin to repair itself and correct visible damage. Some antioxidants like vitamin C can also stimulate collagen production, which is vital for youthful skin. Anxiety is thought to be correlated with the lowered total antioxidant state. It stands to be a reason, therefore, that enhancing your diet with foods rich in antioxidants may help ease the symptoms of anxiety disorder and depressive symptoms. Food sources. The best source of antioxidants are plant-based foods, especially vegetables and fruits. Foods that are particularly high in antioxidants are often referred to as superfood or functional food. Vitamin A. Vitamin A is a fat-soluble vitamin. It can be found in many fruits, vegetables, eggs, whole milk, butter, fortified margarine, meat, oil, and oily saltwater fish. It can also be made in laboratory. Carotenoids are a group of yellow or orange chemicals found in plants. Some of these can be converted into vitamin A in the body. The recommended daily allowance for vitamin A is 600 microgram, which can be easily reached by following the whole food diet. And for lactating females, 950 microgram. However, it is important not to exceed the tolerable upper limit, that is 10,000 international unit or 3,000 microgram for adults to prevent toxicity. Food sources of vitamin A are carrots, squash, papaya, broccoli, apricots, peaches, melon, avocado, bell pepper, eggs, cheese, mangoes, fish, meat, and sweet potatoes. Measles. Taking vitamin A by mouth seems to reduce the risk of measles, complications, or death in the children with measles and vitamin A deficiency. Ability to see in low light conditions. Taking vitamin A during pregnancy seems to reduce night blindness by 37% in malnourished during women. Vitamin A might work better for this condition when taken with zinc. White patches inside the mouth that are usually caused by smoking, that are oral leukoplakia, uh, can also be significantly reduced when taking vitamin A by mouth. People also use vitamin A to reduce complications of disease such as malaria, HIV/AIDS, measles, and for fertility, diarrhea, vision, child development, skin disorders, infections, and many other conditions. Signs of vitamin A deficiency. There are many signs of when vitamin A is deficient in the diet. A few are dry skin, dry eyes, night blindness, infertility, poor wound healing, acne and breakouts, delayed growth, throat and chest infections. The signs of vitamin A deficiency are predominantly ocular. They include night blindness, conjunctival xerosis, bitter spots, corneal xerosis, and keratomalcia. The term xerophthalmia dry eye comprises all the ocular manifestations of vitamin A deficiency, ranging from night blindness to keratomalcia. Vitamin C. Vitamin C is one of the many antioxidants that can protect against damage caused by harmful molecules that are called as free radicals, as well as toxic chemicals and pollutants like cigarette smoke. Free radicals can build up and contribute to the development of health conditions such as cancer, heart disease, and arthritis. The recommended daily allowance for vitamin C is 45 to 120 milligram depending on the age and sex. Vitamin C supplements should meet the RDA and stay well below the established international unit limit, that is 400 for young children and 1200 milligram for kids that are aged 9 to 13 years, and 1800 milligram for teens and 2000 milligram for adults. These are the upper limits for doses. Vitamin C is one of the safest and most effective nutrients. Experts say citrus fruits, tomatoes, green leafy vegetables are the basic plant products. These are the other sources of vitamin C. Guava, 1 cup of kiwi fruit, peas, strawberry, orange juice, dark leafy vegetables, large pepper, broccoli, papaya, mangoes, and berries. Vitamin C is also known as ascorbic acid. It is necessary for the growth, development, and repair of all body tissues. It is involved in many body functions, including the formation of collagen, absorption of iron, the proper functioning of the immune system, wound healing, and the maintenance of cartilage, bones, and teeth. Vitamin C is not stored in the body, excess amounts are excreted, so overdose is not a concern. But it is still important not to exceed the safe upper limit of 2000 milligram a day to avoid stomach upset and diarrhea. It provides protection against immune system deficiencies, cardiovascular diseases, prenatal health problems, eye diseases, even skin wrinkling. The tolerable upper intake level or the maximum amount is you can take in a day that likely won't cause harm is 2000 milligram. Deficiency of vitamin C is relatively rare. and primarily seen in malnourished adults. In extreme cases, it can lead to scurvy that is characterized by weakness, anemia, bruising, bleeding, and loose teeth. These are the symptoms of vitamin C deficiency. Easy bruisability, nose bleeding, digestive disorders, immune system impairment, joint pain, dry skin, dry split hair, slow wound healing, and gingivitis. Vitamin E. Vitamin E is an important vitamin that is required for the proper function of many organs in the body. It is also an antioxidant. This means it helps to slow down process that damages cells. The recommended dietary allowance for vitamin E for males and females aged 14 years and 15 years is 15 milligram daily or 22 international units, including women who are pregnant. Lactating women need slightly more at 19 milligram daily. Vitamin E is a vitamin that dissolves in fat. It is found in many foods, including vegetable oil, cereal, meat, poultry, egg, fruit, vegetable, and wheat germ oil. It is also available as a supplement. Vitamin E is used for treating vitamin E deficiency, which is rare but can occur in people with certain genetic disorders and when very low weight premature infants. These are the food sources for vitamin E: almonds, green olives, sunflower seeds, papaya, bell pepper, mustard greens, pine nuts, cold pressed plant oils, dried apricots, red chili powder, paprika, and avocados. Health benefits of vitamin E. These are helpful in menstrual cramps like dysmenorrhea when taken from the second day of the cycle. An inherited disorder that causes red blood cells to break down in response to stress, that is glucose 6 phosphate dehydrogenase deficiency. Vitamin E is required. Some researchers show that taking vitamin E by mouth, alone or together with selenium, might benefit people with an inherited disorder called glucose 6 phosphate dehydrogenase deficiency. Bleeding within the skull, intracranial hemorrhage, when happens, can be controlled slightly by supplementation of vitamin E. Bleeding into or around the fluid-filled areas of the ventricles of the brain. Conditions in a man that prevent him from getting a woman pregnant within a year of trying to conceive, male infertility. Vitamin E helps to reduced benefits of nitrate therapy that happens when nitrates are used all day. Swelling is reduced, premenstrual syndrome, and a movement disorder often caused by antipsychotic drugs that is called as tardive dyskinesia. These are the vitamin E deficiency symptoms: greasy stools, visionary problems, a feeling of numbness, muscle weakness, the improper functioning of the immune system, less production of bile, chronic diarrhea, dysarthria, myopathies, and spinocerebellar ataxia. Vitamin B group. Thiamine. Thiamine vitamin B1 is a water-soluble vitamin. It is essential for the utilization of carbohydrates. Thiamine pyrophosphate, TPP, the coenzyme of carboxylase, plays a part in activating trans-ketolase, an enzyme involved in the direct oxidative pathway for glucose. The main source of thiamine in the diet is cereals, rice, and wheat, which contributes from 60 to 85% of the total supply. The two principal deficiencies that can be caused by thiamine are beriberi and Wernicke's encephalopathy. Beriberi can occur in three forms: dry, wet, and infantile form. The dry form is characterized by the nerve involvement, peripheral neuritis. Wet form characterized by heart involvement, cardiac beriberi. An infantile beriberi is seen in infants between 2 to 4 months of age. The affected babies that have infantile beriberi have multiple neuropathies. Wernicke's encephalopathy, seen often in alcoholics, is characterized by ophthalmoplegia, polyneuritis, ataxia, and mental deterioration. It occurs occasionally in people who fast. Riboflavin. Vitamin B2 is a member of the B group vitamins. It has a fundamental role in cellular oxidation. It plays an important role in maintaining the integrity of mucocutaneous structures. It is also involved in antioxidant activity, being a cofactor for the enzymes like glutathione reductase, and is required for the metabolism of other vitamins like vitamin B6 and niacin. It is the richest natural sources for vitamin B2 or riboflavin are milk, eggs, liver, kidney, green leafy vegetables. Riboflavin deficiency almost always occurs in association with deficiencies of other vitamin B complex vitamins such as pyridoxine. It is usually a part of multiple deficiency syndrome. Pyrotoxin vitamin B6 exists in three forms: pyridoxine, pyridoxal, and pyridoxamine. It plays an important role in the metabolism of amino acids, fats, and carbohydrates. It is widely distributed in foods, for example, milk, liver, meat, egg yolk, fish, whole grain cereals, legumes, vegetables. Pyridoxine deficiency is associated with peripheral neuritis. Zinc. Recommended amount that is RD recommended dietary allowance for zinc in adults above 19 years of age is 11 milligram a day for men and 8 milligram for women. Pregnancy and lactation require slightly more at 11 milligram and 12 milligrams. Although zinc is a redox inert metal, it functions as an antioxidant through the catalytic action of copper zinc superoxide dismutase, stabilization of membrane structures, protection of the protein sulfahydryl groups, and upregulation of the expression of metallothionein, which possesses a metal binding capacity. Zinc's antioxidant role in protecting against free radicals include oxidative damage. Zinc protects against UV radiation, enhances wound healing, contributes to immune and neuropsychiatric functions, and decreases the relative risk of cancer and cardiovascular diseases. These are the 10 foods that are rich in zinc: oysters, beef, chicken leg, firm tofu, leaf porks, hemp seeds, low-fat yogurt, lentils, oatmeals, and mushrooms. Mineral antioxidants. Mineral antioxidant. Oxidative stress increases with the iron deficiency and iron deficiency anemia. However, doses of ferrous fumarate for 3 months can increase the oxidative status by increasing the MDA level. Selenium is a serious factor of biological and antioxidant protection of vascular endothelium, of low density lipoproteins, protection of DNA chromosomes. As a food component, selenium is an exceptional agent of protection from atherosclerosis, coronary ischemic disease, and cancer. Selenium is of fundamental importance to the human health and is an essential component of several major metabolic pathways, including antioxidant defense system, thyroid hormone metabolism, and immune function. Many whole grains and the dairy products, including milk and yogurt, are good sources of selenium. Fruits and vegetables contain selenium, and other sources are described. Copper is a trace mineral, an essential nutrient to humans. It must be obtained through diet or supplements. This antioxidant nutrient helps your body use iron. Copper is a zinc balancing mineral important in many enzymes as well as in the production of hemoglobin, the molecules that transports oxygen to the blood. Manganese. Manganese is a trace mineral that is present in tiny amounts in the body. It is found mostly in the bones, liver, kidneys, pancreas. Manganese helps the body form connective tissues, bones, blood clotting factors, and sex hormones. Other foods that are believed to be good sources of antioxidants include eggplants, legumes such as black beans or kidney beans, green and black peas, red grapes, dark chocolate, pomegranates. Food with rich, vibrant colors often contains the most antioxidants. Following foods are good sources of antioxidants like blueberries, apple, broccoli, spinach, lentils. Include a fruit or a vegetable every time you eat. Meals and snacks are included. Have a cup of green tea or matcha tea every day. These are the tips for healthy lifestyle and to make antioxidants full in the diet. Look at the color of your plate. If your food is mostly brown or beige, the antioxidant levels are likely to be low. Add in foods with rich colors such as kale, beets, berries. Use turmeric, cumin, oregano, ginger, clove, and cinnamon to spice up the flavor and antioxidant content of your meals. Snacks on nuts, seeds, especially Brazil nuts, sunflower seeds, dried fruits, but choose those with no added sugar or salt. Effect of cooking. Cooking particular foods can either increase or decrease antioxidant levels. Lycopenes is the antioxidant that gives tomatoes their rich red color. When tomatoes are heat treated, the lycopenes become more bioavailable, easier for our bodies to process and use. However, cauliflower, peas, zucchini lose much of their antioxidant activity in the cooking process. Keep in mind that the important thing is eating a variety of antioxidant-rich food, cooked and raw. A high intake of beta, what can be the risks if if a person is taking excessive amount of these antioxidants? A high intake of beta carotenes, for example, has been linked to an increased risk of lung cancer in smokers. A high dose of vitamin E has been found to increase the risk of prostate cancer, and the use of some antioxidant supplementation has been linked to a greater risk of tumor growth. Antioxidant supplements may also interact with some medication. It is important to speak with a health provider before using any of these products. Consuming fruits and vegetables has been linked to a lower rate of chronic disease, and antioxidants may play a role. However, it is unlikely that consuming added antioxidant, especially in processed food, will provide significant benefits. This is a research that shows serum and dietary antioxidant status is associated with low prevalence of metabolic syndrome. Another study that is done with comparing many countries, and Pakistan was also considered in the study. It shows that a vast majority of Pakistani normal healthy subjects have comparatively lower levels of plasma ascorbic acid as compared to the Western population. Now coming towards the MCQs. MCQ number 1. Antioxidant is a substance which catalyzes the formation of free radical, a substance which neutralizes the formation of free radical, an oxygen free radical, or none of the above.
B.
Yes, B is the right answer. A free radical is a cell that promotes health throughout the body. B, a naturally or artificially occurring substance that causes disease if left unchecked. C, a vitamin that is distributed at no change at health food stores. And yes, B is the right answer. A free radical is a naturally or artificially occurring substance. MCQ number 3. Under special circumstances, free radicals can be a good thing for your body because they can give you a boost of energy at the end of long distance workout. They can protect your skin from sun's harmful rays. They cause mutations in our genetic code, and without that, our species wouldn't evolve. They are the weaponry that your body uses to fight off viruses and bacteria.
D.
D is the right answer. They are the weaponry because sometimes oxidative stress is generated to fight off viruses and bacteria. MCQ number 4. A pale child comes to a physician. His pale. His mother tells about exhausted behavior and off and on bleeding from mouth when he uses toothbrush. CBC report shows a hemoglobin level 9.8 milligram per deciliter. What can be the likely reason?
B.
Beta thalassemia, vitamin C deficiency,
Vitamin C deficiency.
Yes, D is the right answer, vitamin C deficiency. MCQ number 5. What is the best way to prepare vegetables to retain the most antioxidant activity? One should steam lightly, cook at high
Steam
temperature.
lightly.
Boil.
Steam lightly is the right answer. A is right answer. Vitamin E protects lipids by scavenging peroxyl radical, chelating metal ions, reducing molecular oxygen, or all of the above.
All of the above.
Excavators. A is the right answer because vitamin E protects lipids by this mechanism. A male patient aged 50 years presents to IOPD with a complaint of constant itching in his eyes. However, the itching stops on using emulsant eye drops for some time. The man is allergic to dairy foods, keeping in view the dietary deficiency. Which of the following can be the possible cause? Vitamin A deficiency.
Vitamin A deficiency.
Yes, A is the right answer. Vitamin A deficiency. Dangerous oxidative products can be controlled to hydrogen peroxide and then to water by the action of vitamin C, vitamin E, carotenoids,
Vitamin
or
C.
zinc. D, zinc is the right answer. The recommended daily requirement of vitamin A in a lactating woman is A 600 microgram, B 750 microgram,
B.
milligram.
600.
C is the right answer.
600.
950. A 55 years old woman comes to OPD with the complaint of shortness of breath on exertion that gets swollen foot when she works in kitchen for a little longer. She also notices her abdominal girth is increasing. Keeping in mind the deficiencies of vitamin and oxidant, what is the most likely cause? Vitamin
Vitamin B12
B1,
deficiency.
vitamin B3 deficiency, vitamin B12 deficiency, or vitamin D deficiency?
B1.
Correct
C.
answer is A, vitamin B1 deficiency, because these are the sign symptoms of cardiomegaly or cardiac involvement that happens in wet beriberi that are because of thiamine deficiency. This is the key. These are the references, and thank you.
Thank you very much, Dr. Isma. If anyone has any question, he or she can ask. Okay, we can end this meeting.